The baby formula shortage doesn't seem like it will end anytime soon, with many grocery stores limiting the amount customers can buy, and experts saying it could be months before the supply improves. Joining us now to discuss what parents should know is Camilla Martin, a pediatric nutritionist with UW Health Kids in Madison. Camilla, thank you so much for joining us this morning.
Of course. Thanks for having me. Good morning, everyone.
So, do you have any tips for parents, what they should and shouldn't do when trying to make that formula last?
We've had questions come in to our specialty clinics at the Children's Hospital about this just about every day. So the important things we'll start with is the do nots. So there's a lot of really scary information circulating on social media about how to stretch out water by adding additional water. Here's a recipe to make a homemade formula. These are actually quite dangerous for infants for a couple different reasons. And most is because infants' bodies are not able to process things the same way as us adults are. Us adults have a really developed immune system and digestive system so that we can handle things. But for babies, they're not able to process that. So if we're thinning out formula by adding extra water, that can actually be, their kidneys aren't able to process that extra hydration. So it can be quite dangerous for them. Similar for homemade formulas, their gut isn't developed enough to be able to break down things the same way that ours are. So lots of the homemade formulas out there that start with evaporated milk or goat's milk or cow's milk, a baby's body isn't able to break that down. So when it's going through the gut undigested, it can cause a decent amount of damage and result in gut bleeds and long-term damage. So we're really strongly encouraging families to avoid doing that. The do's is the best option would be to find an alternative brand. So the tricky thing right now is the shelves are so thin that families are having to go from store to store and still aren't able to find the brand that their baby or young child is used to. So the best option would be to work with your healthcare provider to find an alternative. Each different company uses slightly different language for different types of formula. However, we'll generally have something in each category, or we'll have something in a different category that's close enough that should be a safe alternative temporarily. So that would be the best option for families to do, is to find an alternative, because that is going to be the safest thing for their baby to take.
And as this shortage continues, what other resources should parents be looking at?
We've been strongly encouraging our families to reach out to the WIC office or to their healthcare provider. The Women, Infants, Children program is a really fantastic resource for a ton of great nutrition information, for breastfeeding resources. So a lot of families are asking about breastfeeding and if they can restart that, or if they can get better information about it beforehand to avoid having to deal with the formula shortage. Healthcare providers will generally have access to a breastfeeding specialist at their local clinic, but the WIC programs generally have a breastfeeding specialist there, as well as a registered dietitian and other nutrition professionals. So what's helpful about the WIC program right now is they've allowed temporary alternatives to the main formulas that they typically provide. So they have a whole list of different brands and different sizes that families can get to make it easier. It's really surprising for a lot of families to know that they may qualify. Most people think about it being income-based, and it primarily is. There could be some special situations that would make a family automatically eligible. Like if a child is in the foster system, they're automatically eligible for WIC. If they have certain healthcare conditions that would make them qualify for Medicaid or Badger Care or Forward Health, that could make them automatically eligible. So we're encouraging them to reach out to their local WIC office. They'll have some resources that can help find formula, as well as some safe alternatives and good breastfeeding support.
All right, well, thank you so much for joining us this morning and for sharing some tips for our parents that are watching.